Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Tonight we focus on osteoarthritis. It's the most common type of arthritis, but what exactly is it and how can it be treated?
It's a type of arthritis that is caused by the gradual loss of cartilage in the joint. Cartilage lines the joint, so as the cartilage is lost, the bones become closer, and as you've probably already heard, bone rubbing on bone is what causes the pain in osteoarthritis.
We hear about it more with women and the lack of calcium. Are these true statements?
People oftentimes confuse osteoporosis and osteoarthritis. Osteoporosis is bone thinning, causing increased fractures, and that's from a lack of calcium. People who have less osteoporosis or have a decreased risk for osteoporosis have more osteoarthritis. So there's actually an inverse relationship between the two.
Can osteoarthritis worsen over time?
Definitely. So once the cartilage is lost, you can't really gain it back. There are different medications and treatments that we can use to help patients keep active and doing what they'd like to do.
What are some of the treatments?
Some of those treatments include Tylenol or acetaminophen, which is the most common. There's also anti-inflammatory agents, NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, even prescription strength ones such as Celebrex and meloxicam.
Are there any non-medication treatments?
Physical therapy is very important to strengthen the muscles around the joint so they can keep on working well. Also losing weight, a common risk factor can be obesity.
Is there a certain age that this affects you?
Definitely later in life is when you more commonly see osteoarthritis. Younger people can get early osteoarthritis if they have other conditions.
Is there anything someone can do on their own to treat osteoarthritis?
If it feels better with the NSAIDs and Tylenol, I think that's fine, but if it continues, it might be worthwhile getting a workup, like getting an x-ray done and perhaps getting a targeted physical therapy regimen for that joint.